Welcome to Social Work Updates. In this video, we are going to talk about transference and countertransference. Within a therapeutic framework, Freud and Brewer first recognized and explored transference and countertransference. These ideas were central to psychoanalytic treatment, but they have now been incorporated by most kinds of psychotherapy. These ideas may be found in every connection, including the therapeutic relationship. So, what is the difference between transference and countertransference? Transference. In therapy, transference occurs when a client unwittingly transfers sentiments about someone from their past onto the therapist. Transference was defined by Freud and Brewer as the profound, strong, and unconscious feelings that arise in therapeutic connections with patients. They looked at transference to account for distortions in clients' perceptions of reality. While Freud considered transference to be abnormal, repetitious, and unreflective of the client-therapist interaction at the time, current psychology has rejected this view. Several psychological theories realize that a therapist's comments may elicit reactions in the client, and that the process of interaction can be useful or detrimental to treatment. Positive transference. When pleasant parts of previous relationships are reflected onto the therapist. This can help the client regard the therapist as caring, smart, and empathic, which can help the therapeutic process. Negative transference. When unpleasant or angry sentiments are projected onto the therapist, this is called projection. While this may appear to be harmful, if the therapist identifies and accepts it, it may become a significant topic of conversation, allowing the client to evaluate emotional reactions. Sexualized transference is when a client gets drawn to their therapist. Feelings of closeness, sexual desire, veneration, or romantic or sensual emotions are examples of this. A therapist can acquire insight into a client's thought patterns and behavior by identifying when it occurs and understanding where it is coming from. Transference is mainly caused by behavioral habits formed during a childhood connection. Types of transference include paternal transference, seeing the therapist as a powerful, wise, authoritative, and protective father figure. Depending on the client's connection with their father, this may elicit sentiments of adoration or irritation. Maternal transference, associating the therapist with a caring, influential, nurturing, or soothing mother figure. Depending on the client's relationship with their mother, this sort of transference might inspire trust or unfavorable sentiments. Sibling transference can represent sibling relationship dynamics and happens frequently when a parental bond is absent. Non-familial transference. When clients idealize the therapist and reflect prejudices that influence the client, this occurs. A priest, for example, is considered sacred, and a doctor is meant to cure and heal illnesses. Sexualized transference. When a person in treatment feels a sexual interest to their therapist. Eroticized transference is an all-consuming attraction to the therapist that can be harmful to the therapeutic bond and the client's progress. Countertransference. Countertransference has been defined as the therapist's reaction to the client's projections onto the therapist. It has been characterized as the redirected sentiments of a therapist toward a patient and the emotional entanglement that might arise with a patient. While Freud considered countertransference to be harmful since a psychoanalyst is expected to be entirely impartial and detached, such beliefs have subsequently been questioned. Racker developed the concept that the therapist's sentiments are essential and can lead to crucial information to be worked out with the client. Countertransference, according to him, is that which develops from the analyst's identification of himself with the client's internal objects. When these emotions emerge, they may be addressed, leading to a productive therapeutic partnership. And that's it. Thanks for watching. For more social work updates, please watch and like the video, hit the bell and subscribe to my YouTube channel.